We need to talk about ableism. What is it? Why is it damaging to autistic people? And why do we often do ableism to ourselves as autistic people? Let's chat. Hi, I'm Phil, a late diagnosed autistic older adult, and it's my goal to advocate for autistic adults by providing positive science-based information about autism and by sharing some of my own stories along the way. Okay, so first up, what on earth is ableism? Ableism is the fundamental belief that assumes that people with disability are a problem that needs fixing. In the context of neurodivergence, this implies that the neurotypical brain or way of thinking is the default or is normal, and anything outside of that assumed normality is deficient, broken or substandard. In essence, a value judgment is implied, and the value given is bad or negative. But it does not end at the door of abstract concept or quiet judgment. In practice, what follows are demands, both explicit and implied, that autistic people should conform to the behaviours and standards of the wider world. In autism, this might look like demanding eye contact, expecting neurotypical forms and expressions of communication or social engagement, framing autism as a disorder with the implication that it should be fixed, eradicated or cured. The assumption that all autistic people experience the same traits and maybe label those traits as symptoms, and by doing so assign a negative value judgment on autistic people and our experience. This can then lead to gaslighting autistic people who might not have the expected list of symptoms or deficits, and claiming that they can't be autistic because they appear to be intelligent or otherwise functional. Or likewise, minimising an autistic person's experience with phrases like, "You must be very high functioning," or "You don't look autistic." In the workplace, this might look like dismissing an autistic person's requests for accommodations, or insisting on the autistic person working in the same environment as everyone else, in spite of the sensory hell of that environment to the autistic person. Then punishing the autistic person for failing to meet productivity standards while working in that overstimulating environment. Likewise, autistic struggles with transitions or perceived social deficits might be greeted with punishments or loss of the employment altogether. Not to mention workplace hiring practices that typically make it extremely difficult for an autistic person to be considered for a job in the first place due to interviewing styles or perceived difference in how the autistic person might present or communicate. In families or relationships, ableism might look like expectation of neurotypical communication styles, or being agitated or dismissive of the autistic person's need to move or stim, or even demanding or coercing the autistic person to suppress their stimming. Bullying or degrading comments or slurs can also be added in here and might occur in school environments, workplaces, families, or even relationships. Even medical settings might trigger ableist behaviours from doctors who might dismiss our descriptions of symptoms or even levels of pain, because our autistic interoception, which is our awareness or indeed lack of awareness of what's happening inside our bodies, might mean we experience these symptoms or pain differently than expected, or we might not be able to wrap words around those experiences. In fact, this is an experience that sadly many autistic people go through. In my case, after experiencing repeated and prolonged excruciating night pains that were severe enough for me to consider whether a more permanent end to that pain might be preferable, the doctor's response was literally, "We're not too concerned about that." And likewise, having just had what I now know was a stroke, being repeatedly dismissed and sent away without any diagnosis, treatment options or further investigation because I did not present like a stroke patient. In fact, in that situation, I had to insist over several successive days of appointments to be escalated to a specialist. If we move on to how autistic people have typically been portrayed in TV and movies, we can see portrayals of either severe autistic traits to create pity, or savants or geniuses. This leaves the experience of most autistic people unrepresented and leading to a skewed public understanding of autism, which reinforces the ableist cycle. This might also lend weight to the fallacy that autistic people have amazing traits, or superpowers as some might call it, where mostly we don't. Ableism can also lead to abuse and exploitation of autistic people. We might be taught over a lifetime that the goal is to be more neurotypical at the expense of trusting our own preferences, boundaries, and even instincts, making autistic people more vulnerable. And of course, one of the most devastating ways ableism can affect autistic people is when we might need to interact with law enforcement. In this situation, ableist approaches have frequently deemed an autistic person as non-compliant, with the all too often result of that person being handled with violence or worse. In these moments of extreme stress and dysregulation, an autistic person may experience a meltdown, which might be incorrectly seen as violent, drunk, or drug-affected behaviour, or maybe worse still, shut down or freeze, where the autistic person may become slow to respond or unresponsive to high-pressure commands, leading to the incorrect assumption of deliberate non-compliance or defiance. Many autistic people have not survived this situation. Other common ways that ableism shows up in autism can be as simple as how we define the autistic experience. By this I mean classifications such as low functioning or even high functioning are ableist in nature, as they assume that an autistic person's capacity can be measured against neurotypical norms or even against other autistic people to create a category. As we have stated several times in these podcasts, the risk of using these labels is that by labelling someone as low functioning, we may dismiss their potential altogether and remove opportunities for them as a result. Likewise, the high functioning label downplays the very real daily struggle that all autistic people experience, in spite of maybe appearing to function close to neurotypically to an outside observer. And this may mean that the autistic person is denied appropriate supports. These autists might be masking extensively and paying a high price in private with fatigue, burnout, anxiety, depression, and other forms of mental illness as the cost of this masking. Ableism also shows up in pretty much all public spaces with the onslaught of sensory overwhelm, from noise to bright lights, visual movement, smells, and people in general. These spaces seem to be designed to add sensory stimulus, which is exactly what autistic people don't need, and can actually cause physical pain as a result. And this is an all-day, everyday experience that many autistic people need to negotiate. And of course, the pity response to our autism disclosure is deeply ableist, as it takes the assumption of autism being bad or negative. So we can get an idea from this that ableism can be damaging to any person with a disability. And this is especially true for ableism directed towards autistic people. And let's be clear here also, autism is a disability, not just a quirk, fad, or trend. Yes, autism is also described as a difference, and that is correct. But that difference means that autistic people are both treated differently and have to survive in a world that hates difference. Both of these things, along with some of the core features of autism, make living as an autistic person disabling. Now at this point, rather than go into detail about autism and the models of disability, what I think I will do is hold that thought and devote the next podcast to autism and disability to explore that topic in the depth that it deserves. So let's refocus our attention on ableism and in particular why it is so damaging for autistic people. Ableist language reinforces community misunderstandings about autism, which in turn reinforces discrimination. Ableism leads to chronic stress, anxiety, and depression in autistic people, and erodes self-esteem as autistic people are devalued by society. Ableism also leads to social rejection and isolation of autistic people as deficit labels and social difference are emphasised. Okay, so we can see that ableism is damaging, but at the beginning of this discussion I made the statement that we as autistic people often do this to ourselves. Why would we do that if it's so clearly damaging? So firstly, let's define a new term, and that is internalized ableism, which is when people with disabilities absorb and accept negative stereotypes and prejudices about their disability. It's not a conscious choice, but rather a response to societal messages that devalue the disability. As autistic people, we are predisposed to copy other people and to try to please or appease others. This is called fawning and is a fundamental threat response like fight or flight. And when autistic people spend a lifetime being told that we are in some way faulty and need fixing so we can be more neurotypical, we also start to believe this is true. And so we may start to reinforce those messages within ourselves. Maybe we also start to use ableist language about ourselves and our own experiences. Or even start to judge ourselves against neurotypical standards, highlighting where our own experiences or our life outcomes may fall short. Internalised ableism has its own unique implications for autistic people. Firstly, internalised ableism introduces self-doubt, which can be both disempowering and make it less likely the autistic person might seek out help or accommodations. This also means we are more likely to accept the false premise that we are in fact defective or that we need to hide our differences, leading to extensive masking in an attempt to fit in, and then to burnout or meltdown as a result. This excessive masking can also mean we lose a sense of our own true identity. Another possible implication of internalised ableism is imposter syndrome, where we might then even start to doubt our autistic identity, or have the feeling of needing to exaggerate our autism to justify that identity. In the context of employment, we might also judge ourselves against neurotypical standards, often leading to internal narratives like failure. Autistic people, by the very nature of the way our brains function, have what's called uneven productivity, where one day we might be laser focused and achieve amazing outcomes, but on another day we might not be able to start any significant task or even struggle to get out of bed. Internalised ableism here starts to then produce narratives like lazy, failure, not applying ourselves, or useless. The outcome of these narratives, both internalised or external, is often anxiety or depression as we start to believe these wrong thoughts. Or self-blame as we wrongly believe that if we were stronger, more focused, or smarter, we would be better at these things. And because these are usually lifelong experiences, autistic people face a much higher risk of health issues due to the extra stress load the body is constantly dealing with. Consequently, autistic people have a much higher rate of early mortality and even suicide. So how might we respond to ableism, both external and internal? From a societal perspective, I think awareness is a key aspect. Ableism comes from ignorance at societal level. So by starting to break down the myths about autism, we chip away at the foundations of ableism. There will always be arrogant and selfish people in society who just don't care that their attitudes, actions and language harm other people. But by educating the people around them, their words and actions start to look foolish. But it's not just about myths. Society also needs to take responsibility towards making the world more accessible to all people with disability. And we will dive deeper into that in our next discussion. Attitudes towards difference is a key aspect of all this. Ableism thrives where difference is value judged as something bad. So changing these attitudes in favour of acceptance would make a huge difference. Changing language is another important aspect. Removing deficit-based descriptions of autism, neurodivergence and disability in general is a necessary step. And when it comes to how we deal with internalised ableism that has been ingrained into us, educating ourselves about autism in general and how our experiences fit helps us break the cycle of self-blame and unhelpful internal narratives. Understanding that our stims or quirky behaviours are shared by our autistic peers helps reconcile these behaviours as not being bad or unique to ourselves. And on internal narratives, changing the language we use about ourselves can be important. Connecting with other autistic people and learning from shared experience can be a huge help. For me, connecting with all of you in the comments section has been a great help in combating my internalised ableism. Being kind to ourselves or exercising self-compassion or self-forgiveness for the things that went wrong or we did that caused the internal cringe. And recognising that grief is a natural step in processing where things went wrong. And understanding that imposter syndrome is real and does not need to shape our future by denying who we are. And by being aware of imposter syndrome and accepting it as a natural part of our self-acceptance journey, we might be able to move through it with less internal struggle. Many autistic people have also found that adopting identity-first language can also help with easing internalised ableism. By identifying as autistic rather than a person with autism, we might better accept that this is a core and valuable part of our person, rather than something that is just hanging off our personality. But of course, how any person identifies is a personal matter. So if someone chooses to identify as a person with autism, that is their choice and should not be seen as a negative thing by another autistic person. And the extension of this is using the preferred mode of identification that an individual has chosen when referring to themselves as a matter of respect to their autonomy and identity. In conclusion, there will always be people who respond to us with ableism. Some will choose to do that as a way of trying to assert their own dominance. These people are not worth the time, and it may even be that their own insecurities lead them down this path. Mostly, people responding with ableism will do so out of ignorance. So it can be worth keeping this fact in mind before we either buy into the ableism and internalise it further, or conversely zealously try to put them straight with the facts. In this case, gentle education might be productive, but not at the expense of ourselves. By this I mean that some autistic people in this situation might not have the internal resources to engage, and doing so might tip them into overwhelm, shutdown or meltdown. It's not your responsibility to educate every person in the world about autism, so there should be no guilt if you need to step away or not engage. Other autistic people may have the energy or resources to gently engage and educate, and that's also fine. But we need to look after ourselves firstly. And to be perfectly blunt here, we have probably all done ableism at some point, whether in regards to other neurodivergent people or people with disabilities in general. I know for me, particularly before I had an understanding about my autism or autism in general, some of my attitudes were quite ableist. And in terms of my ableist actions, before my autism understanding, I even denied another autistic person a job when I was in a management role. Something now that I deeply regret and acknowledge was ableist and discriminatory. So if you want to dive into that story in more depth, I will place a link to that somewhere here. Okay, so that's a brief intro into ableism. If you're autistic, have you experienced ableism in your journey, or do you struggle with internalised ableism? And if you're not autistic, have you found yourself using ableist language or having ableist attitudes unknowingly? Let's chat further in the comments section. No judgment. If you find this podcast helpful, please consider liking and subscribing, or sharing them with someone who might also find them helpful. And as mentioned, next time we will dive deeper into the question, is autism a disability? So until then, thanks for watching. Bye for now.